Hi everyone, my name's Amy Barry. I'm the lab manager in Care Liverpool and Care Chester. Welcome to the Care Fertility virtual information event. It's good to see so many people here. Shame that I can't see you, but I hope that you can see and hear me okay. So basically, we're going to go through everything that you need to know for your journey at Care. So we're going to go through a presentation. There'll be a couple of videos, and we'll have a couple of Q&A sessions as well, where you can answer, where you can ask, and we will answer some of your questions. We've had some pre-submitted questions that we have already, but you're welcome to send any more through. You can do it on the private questions tab on this platform, or you can do it in the public chat. That just means if you put it in the chat, that we'll be able to see your first name. So if you want to keep it private, then you can do it on the questions tab, or you can send your questions to events@carefertility.com. So we're going to go through the diagnosing a fertility problem, the IVF treatment pathway, treatment with donor eggs, sperm and embryos. We're going to go through some lab techniques, the support that's available for you at Care, funding that's available for you, and getting started with Care. And then, as I said, we'll have two Q&A segments, and we'll be joined by Professor Charles Kingsland. So there's a bit of a presentation, give you time to think of some questions for us. If we don't have time to answer your question, don't worry, we'll try and get back to you by reply email. And if you think of any questions after the event, you're more than welcome to email the events@carefertility.com email address. There is a patient inquiry team available until 8 o'clock tonight. They're available on 0800 564 2270, so you can catch them tonight if you wanted to. Okay, so we're going to start with a quick video, just a bit of an introduction to Care, so bear with me.
Family. It's who we are and who we're always going to be. It's the important little moments, the big emotions, the beating heart at the centre of our world. It's the journey that we take there, together, one step at a time. Family is the one thing we'll always care about the most, because we believe that family is for everyone. And through our care, we'll do everything we can to make your dream real. We don't just care, we are Care.
My name is Professor Charles Kingsland, and I'm the Group Clinical Director for Care Fertility. At Care, our number one belief is family for everyone, and this means we do everything possible to help everyone start or grow their family. We know that nothing is as important as family, and that's why we care so much about wanting to give every patient that comes to us their best chance of having a baby. Of course, families come in all shapes and sizes. We get heterosexual couples, couples of the same sex, we get single patients wanting to start a family, we get NHS patients. When you have a fertility problem, there should be facilities available for you to get the best advice and the best treatment readily available to give you the best chance of having a baby at a time in your life that is best for you. We will use all our knowledge and experience combined with highly individualized treatment, personal treatment, to help you have the family you are longing for.
Unbeknown to Gemma and I, we both carry a gene, a deafness gene. We actually have a daughter who was 3, but who was born prematurely deaf. And we were given the option and chose to go down a fertility treatment to kind of avoid our second child having that same gene.
We were very lucky in the fact that the clinic was only down the road from us, so we felt there was one around the corner. It had good reviews. We just felt it was good for us, didn't we?
The whole package made us just feel really comfortable that actually going with Care was the right decision.
So the team that we worked with at Care were unbelievable. They were caring, they were sensitive, they were compassionate, empathetic, and even when I was ringing out with I was feeling pains down one side, that the reassurance that they gave me, they honestly do hold your hand every single step of the way, and I feel like they lived the journey with us.
So I've had several treatments with Care, and I now have a baby, and that's taken a number of treatments, fertility treatments, different alternatives, different medicines to try and get it to work for me. I have always said I would recommend Care Fertility. I would recommend them for the comfort factor that I received, the friendliness, and just I think the word is my faith in Care Fertility.
Okay, so we're going to go on to the presentation. So just share. Okay, so hopefully everyone can see this. So obviously this is the starting point for Care. We believe that family is for everyone, and it's really important to recognise that 1 in 6 people need help starting a family, and we're here to make that happen for you. So we help lots of different types of patients, same-sex couples, heterosexual couples, single patients, patients looking to preserve their fertility, and we obviously would like to provide information on all of these treatments as much as we possibly can, but it's quite a lot to cover in the time that we have. So when we go through this presentation, I'm going to refer to the general IVF process, and this should cover most of what you will go through, regardless of the type of patient or treatment that you're having. When you get further down the line in your fertility journey, that's when things will start becoming individualised for you. So hopefully this gives you a flavour of IVF overall. So we've got, as you can see from the slide, lots of different clinics all the way across the country, and this really helps us to be able to provide the care that we do to patients wherever they may be in the country. So it's really easy to get started with Care. We've got a really good patient inquiries team. They're really great to get hold of, really knowledgeable, and they can answer all your questions about treatment and getting started. So as I said earlier, they're here till 8 o'clock tonight. So if you wanted to get in touch with them to ask them any specific questions about getting started, then they're there. And this is Shah on the image here, and we've got Lauren, part of our events team, answering questions along with a couple of others on the questions tab. So the first step obviously is to get the right diagnosis, and this is really important because this is going to inform the type of treatment that you have with us at Care. So we take the time to get to know everything about you. We want to know your history, and we want to know your test results, anything that you've had done previously, and we make this all really easy for you through the patient portal. So this is a secure online portal, and all the information related to your treatment is kept here. So it's 2 ways. So we put lots of things on here for you to see during your treatment, and similarly you can upload things onto here for us to see. So if you've had tests somewhere else or you've had treatment elsewhere, then you can upload previous notes or information to your portal, and then we've got all the information ready. So it will all be reviewed prior to your consultation by the doctor so that they know exactly what your history is and where we need to go. So during your consultation, the specialist will listen to your plans and your wishes, go through any test results that you may have had with us or any previous test results that you've had, and they'll explain any further necessary tests based on ones that you've already had so far. And then based on this information, they'll discuss treatment options with you, what they think would be the best treatment option for your particular case, and discuss the chances of success. So we'll give you detailed information about your treatment options so that you can consider whether they're right for you in your own time. They'll also talk to you about support and costs, which I'm going to go through in a little while, but they'll go over all of that with you again, so to make sure that you have everything you need to get going, and they'll give you all the time that you need to ask questions. So it's really good to go to these consultations prepared and know what you want to get out of it, and have any questions ready to ask. So everyone's different, and as I said, this is a general overview of the IVF process, and you may not be using your own eggs or your own sperm. You may be a heterosexual couple or a same-sex couple, but the general feel for IVF is basically the same. So you may not need IVF, you may need IUI, so that obviously is slightly different, but most care patients do need IVF. So we'll start at the beginning of what the IVF process is. So we have, the first step is to stimulate your ovaries. So we do this using a series of injections, medication in injection form, and you're prescribed this based on a number of things that will be discussed with you at the consultation. And we have a really good video, an online video that teaches you how to administer these injections. So sometimes this can be quite a daunting part of the IVF procedure, but we've got great support from teams and videos online so that you feel comfortable administering the injections yourself. So you'll have the injections for a couple of weeks until we feel like you're ready to go through the egg collection procedure. But we'll only know this by doing monitoring, and we do this through ultrasound scans of your ovaries. So the monitoring phase usually takes between 3 and 7 days, but it does depend on the patient, and we'll do a couple of scans. It might only be one scan just to check that your ovaries have responded to the drugs as we'd expect. And then when we think you're ready, we'll give you the final injection, or advise you to take the final injection, which would be what we call a trigger injection. And that's what's supposed to trigger ovulation, and that's the final maturation step in the process of the ovarian stimulation. And then usually the egg collection is about 36 hours afterwards. So the egg collection itself is a straightforward procedure. An ultrasound guides a needle into the ovaries to carefully remove the eggs. So you can see on the screen here, there's dark pouches, and that's what we call a follicle that's supposed to contain an egg. The procedure can take up to half an hour, but afterwards you should come around quite quickly, have a short rest, and then you'd be ready to go home. So we've collected the eggs, and they're safely in the lab, and now we need to get the other part, which is the sperm. So sperm can be collected in a number of different ways, but usually it's just a sample produced either on-site or off-site, but at the minute, the majority of patients are asked to produce the sample off-site just because of COVID. So you'll be provided with a pot, and we'll ask you to produce your sample and bring it to us on the day of the egg collection. We can collect sperm through different means. So there's minor surgery that we can perform to retrieve sperm if there's not a lot of sperm in the sample. But usually it's a fresh sample produced on the day of the egg collection. So we've got the eggs and the sperm, although I think there was a video on here. So I think I've got a short video of sperm analysis, yes. So this is a really good bit of equipment that we've got, which is a computer-aided semen analysis, or CASA. And you can see that it's tracking the sperm, how they move on the slide. And that tells us how good quality the sperm is. So it tells us how much sperm is there, how well they're moving, and what they look like. This is really good for us to be able to determine if the treatment type that you're having is the right one for you. So back to the presentation. So we've got the eggs and we've got the sperm, and then we're going to go through the fertilisation processes and embryo development. So there's two different ways that we would attempt fertilisation of the eggs, and that's either IVF or ICSI. So IVF is basically where we prepare the sperm sample and we leave around 200,000 normal moving sperm in the dish with the eggs overnight and let them do what they're going to do. We do require the sperm sample to be relatively good quality, so it needs to fulfill certain parameters for us to be comfortable that we would think that fertilisation would be achieved through IVF. If some of the parameters are a little bit lower, then we may recommend a procedure called ICSI. So ICSI is where we would manually inject a single sperm into each one of the mature eggs. And this is just an additional helping hand for those samples that maybe the sperm concentration is a little bit lower, or the way that they're swimming is a little bit slower, just to try and maximise the chance of fertilisation in the lab. So the method of fertilisation is decided before the day of your egg collection. We'll do a semen analysis to make sure that the treatment type that we're recommending is the right one for you. But obviously that can change on the day of treatment. So you may be recommended to have IVF treatment, but that may change based on the sample on the day of the egg collection. So I think we have a video of the ICSI, I believe. Yeah, so you can see this is an egg in the middle, and then we've got a needle on the right hand side that's got the sperm in, just a little dot at the end, and we push the needle in, and then we aspirate a small amount of the egg just to make sure that the sperm is definitely going to go inside, and then deposit the sperm in the middle and carefully move the needle out of the egg. Okay, so the fertilisation rate is about 60 to 70%. So if you had 10 eggs collected, we'd hope for 6 or 7 to be fertilised. Obviously, sometimes it's more and sometimes it's less. That's an average. But once we have fertilisation and we can see that an egg has fertilised, we'll then monitor the embryos over the next 5 or 6 days to see how they're developing and whether they're developing well, and determine what their quality is. So the way that we know that fertilisation has occurred is by the appearance of 2 small circles in the centre of the egg. And that tells us that the DNA from the mother and the DNA from the DNA from the egg and the DNA from the sperm have come together to create an embryo. And then the embryo will divide into 2 cells, into 4 cells, into 8 cells, all the way up to the blastocyst stage, which you can see down in the right-hand corner, where they have over 100 cells, and they've developed to this stage by day 5. So When we know that fertilisation has occurred, we'll give you a call and we'll let you know how many of the eggs are fertilised. And then we'll monitor the embryos. If you've chosen to have the care maps, which you can see on the screen, we get images of the embryos every 10 minutes, and that gives us a video of their development. So it's really valuable for us to be able to select. And we can give you a call midway through to let you know how they're doing. So here on this slide, you can see just a logo for Care Maps on the left, which is what I've just mentioned, and that's a process that we use in the lab to better select the embryos out of the ones that we have for you. So it uses a very high-tech bit of software which tells us the chance of an embryo, what the chances of an embryo creating a baby. And this means that we can give you the percentage chance of an embryo creating a baby out of the group, and make sure that we choose the embryo for you first of all. The other thing that we do to help us select the embryos is something called PGTA, which is embryo biopsy, and you can see the image here on the right hand side is us taking some cells away from that blastocyst embryo, and those cells will be sent away to a genetics lab to be tested to make sure that the embryo has got the right number of chromosomes. And that means that we know that we'd be transferring what we would call a euploid embryo, so a chromosomally normal embryo, which should hopefully maximise the chances of your success in that treatment cycle. All clinics routinely achieve fantastic success rates. There's slight differences between them. Obviously, every clinic treats different patients, so you can ask in the questions tab if you've got specific questions about success rates. You can ask that in the questions tab, or you can send us a quick email. But generally, the success rates are very good across all care clinics. So I'll show you a quick video of the care maps. So you can see this is an embryo developing, and this is about day 4. And it's starting to become a blastocyst now. So it gets a cavity forming in the middle. Fluid starts to build up, and that's what makes the embryo grow. So you can start seeing it expand, and then we end up with a ball of cells here about 3:30, or 3 o'clock now, moving around, and that's the bit that will become the baby. So that's a really important part of it that we look out for. Okay, so we have put the eggs and sperm together. We have fertilisation, we have embryo development. We know which embryo is the best because we've used either Care Maps or PGTA. So now we're going to do the embryo transfer. So most of the time the embryo transfer is guided under ultrasound. The embryo or embryos are loaded into a soft catheter, and that's inserted through the vagina and the cervix into the womb. It's a quick procedure, about 15 minutes, and you can go about your normal activities afterwards. You don't need to lie down or rest. You can if you want to, but you don't have to. And then once you've had the embryo transfer, it's the 2-week wait for the pregnancy test. So after you transfer, the nurse will explain what happens next, and they'll let you know things to avoid doing and things to carry on doing if you're taking medication. We'd obviously recommend progesterone support for implantation. And then we'd say pregnancy test a couple of weeks after the embryo transfer. You give us a ring and let us know the outcome, and then we can get you booked in for a scan a couple of weeks later after that to confirm the result. So here's just an image of the embryo transfer procedure. Obviously, hopefully it's a positive result, but it could be negative. So if it is, get in touch with us, let us know, and we can offer some support. So we have counselling available, readily available, and we'll arrange a follow-up appointment for you to discuss your options and moving forward with your treatment if you wanted to. If it's positive and you have the scan and there's a heartbeat, which is what we're looking for, then we would discharge you to the care of your GP, and then we'd hopefully not see you again for a little while. So that's the IVF procedure as a whole. So I'm just going to talk about the other things, other little things that we've got to mention here. So a little bit about donation. So obviously we, as we've said, families for everyone, and we treat all kinds of different patients, and there's obviously lots of different reasons why donation would be needed. You might need to use donor eggs, you might need to use donor sperm or donor embryos. But we've got dedicated donation teams that have over 25 years experience, and they've helped more people start a family with the help of a donor than any other clinic. So we've got tons of experience in donation treatments. We'll support you throughout the entire journey, from your initial questions all the way through to helping you select a donor. We aim to give you as much support as possible, and we have specialist counselling for this as well. So we have specialist counsellors who can provide you all of the information about what it means for you as parents and legally to use donor eggs, sperm or embryos. Support at care is really important, and we think it's obviously really valuable. It's a very emotional journey, so we want to be able to provide you with as much support as you need. Some people need more than others, some people need nothing, and some people would prefer lots. So we have free counselling appointments, and there's no charge, and you can access them at any point in your treatment. We've also got the Care Buddy system. So this is where you would get buddied up with another patient who's at a similar stage of treatment, so that you can talk about your experiences and help support each other through it. And we also run regular support events. So I think we've just done a walk in the park support event, and we try and do in-person meetups, obviously as much as we can. Recently it hasn't been as possible as we'd like it to be. There's a 24/7 care online forum, and you can chat with other patients on this. So that's a really good place to get information about the care journey. And obviously we'll always support you at every moment. So whether that's nursing, lab, doctor, or even our newly formed Care Pals team, we'll be able to support you all the way through. So a bit about the funding options. This is relatively new to care. So we've got an exclusive IVF funding programme, and the aim is to make funding the treatment easier for you to manage. So we want to be able to support you emotionally and also financially as much as possible. So it's supposed to give you peace of mind knowing that a plan's in place for your treatment, your current treatment and future treatment. And we created CarePay following patient feedback that it was disruptive to have to contact someone else to access funding programmes. There are other ones available. So the feedback was that was a little bit disruptive. So we created CarePay to keep it local and in-house, so that it was as least disruptive as possible for you. So CarePay is managed entirely by our in-house teams, and hopefully you have a more seamless experience, and your treatment's kept personal and private. So if you want any more information on that, you can speak to the inquiries team on the chat here, or ring us up or send us an email. So I think now we're going to go on to the first Q&A. So if I close this down, I should be joined by Professor Kingsland shortly. I'm just checking to see if he's coming on. see. Sorry about this. Not sure where he is. Let's see if I can answer some of the questions that have already come through. So I can see that the questions that have been put on so far have been picked up by the team. So hopefully they've been answered. So we had some pre-submitted questions. And we wanted to talk a little bit about shared motherhood, because there'd been a few questions about shared motherhood specifically, and whether that was something that we do. It certainly is something that we do, and we're doing more and more of it, which is great. So the shared motherhood pathway is managed specifically by the donation team. Oh,
Here I am.
hello.
Hello. I'm sorry I was late.
That's all right.
Are you surprised? Are you surprised to hear that I had a few IT problems? No, you weren't, were you?
No, I have to say, I wasn't.
No, I didn't. How are you, Amy? Sorry, I'm a bit late.
No, that's okay. No worries. There's plenty of questions for you, so
There are loads.
Yeah, we'll go right ahead, because I don't want to run over and keep everyone waiting. So,
shall we just rattle through these then, Amy? Because there's an awful lot. Or would you like to?
Sure. Yeah. Well, I've got the pre-submitted ones here. If you want to go ahead with those.
Okay. Well, I've got what is shared motherhood briefly. It's where a same-sex couple want to create a family, both of them. So you use patient A's eggs. They're fertilized with a donor sperm. The embryos are created and then placed into her partner's uterus. So the partner grows the baby, has the baby, delivers the baby. So she's the birth mother, but the genetic mother is the other partner. So of course, it's all about choice and how same-sex couples want to create their families. And it might be right for some, it might not be right for others. But the important thing is to be able to have that conversation with a doctor or a nurse or a counsellor as to what will be best for that particular couple. And we see a lot of shared motherhood, and it brings a lot of happiness and joy to couples. I'm 37. I've been trying for almost 2 years now. My hubby and I are planning on IVF. However, I was on fertility meds and was informed that my lining of the uterus is very thin. Want to know if there's any treatment for this in your centre? Yes, of course there is. That's what we do, and we're here to help. What we need to do, of course, is to see the couple and take a history, see what's been happening, what happened on the Clomid, and then we can plan the future treatment to give you your best chance. But that's a common problem, and we can address that. Now, if we just look at some more questions. What happens if no eggs are collected or mature? Does this count as a round of IVF? Well, actually, from the NHS point of view, yes, it does. Once you've had your egg collection, so when you've had all your scans and the decision has been made to do an egg collection, irrespective of whether you get any eggs or not, or no eggs at all, then that will count as an IVF cycle. If, however, that cycle is cancelled before the egg collection, so for example, you might not have enough follicles, or there's another reason why we can't go on to egg collection, then that generally doesn't count. That's called an abandoned cycle. Once we've decided together to go for the egg collection, then that's when the cycle starts. Are all patients required to have rubella immunity, or is a proof of MMR2 vaccine sufficient? Well, I would always advise that you have proof of rubella immunity. So an up-to-date rubella immunity test is important, because although rubella or German measles is a very mild disorder, it can cause the virus crosses the placenta and can cause really significant abnormalities in the child. So I would always advise an up-to-date immunity test. However, if you do not want to do that and you've had proof of vaccination and you know the risks, then it's worth discussing your reluctance to have that test with the clinic. And then depending on what their policies are, they may accept you to have treatment. But it's an individual approach. Everybody's different. Everybody has different reasons to be vaccinated or otherwise. Are all patients required to have HIV, hepatitis B, C screening? We are planning for IUI. Yes, that's a legal requirement. We have to have proof that you are within 3 months of treatment, that of your first treatment, that you are negative for hepatitis B, C, and HIV. If you've had a treatment before, then correct me if I'm wrong, Amy, but it's you need to have proof within the previous 2 years.
Mm-hmm. Yeah.
Okay. The lining of my uterus for recurrent implantation is 7.4 millimeters recurrent implantation failure. Would you recommend endometrial scratch? No, I wouldn't. Not necessarily. Can you explain if different culture mediums are used post failed transfer to incubate the eggs? Ooh, that's beyond my level of expertise, but Dr. Barry can answer that one.
Yeah, well, it depends on the situation, but there are certain things that we can do in the lab in terms of culture media to improve your chances. Things like blast gen is one, and we can do something called AOA, egg activation. So there's different things that we can do based on your circumstance. If you've had a failed transfer, yes.
Okay. Are there any side effects with medication long term? The side effects, what we use in IVF are powerful hormones, and they can be side effects, but they're usually minimal. Bloating, maybe hot flushes or irritability, mood swings, but that's all part and parcel sometimes of the fertility process. Are there any long-term problems? No, not really. The major long-term problem is pregnancy, and that there's another question here. Is there an increased risk of miscarriage or ectopic pregnancy and preeclampsia in IVF pregnancies? If so, why? Yes, there is. It's not due to the IVF process itself, but it's due to the individual patients. Firstly, the average age of women or couples coming through the IVF process is a little bit older than the background population, usually 4 or 5 years older, and that can have a significant effect on your increased risk of miscarriage or complications in pregnancy. But if you take IVF per se, if you're 25, for example, and needing IVF, then the risks of pregnancy-related complications and miscarriage are not, they're more age-related. Ectopic pregnancy, there is a slight increased risk of ectopic pregnancy in IVF pregnancies, but that again is usually due to the cause of the fertility. If you've got damage to your fallopian tubes, then inevitably there is an increased risk that the embryo may find its way into the fallopian tube and get stuck and then not be able to find its way out and then grow in the fallopian tube. But rest assured that couples who do get pregnant, we are on the lookout for early pregnancy-related problems very, very early. So most of the time, if there are any complications that arise, hopefully we can diagnose them early and treat them early. I'm 37. I've been trying for almost 2 years. I've already done that one. So sorry about that. Reasons why embryos sometimes fail to thaw.
Yeah, it can be a number of things, but generally the survival rate of embryos post-thaw is very, very good. It's worth saying. Over 95% in care clinics. It's very good. And there are a small percentage of embryos that are just slightly too fragile to survive the freezing and thawing. And it's not necessarily something that we can see. It's not necessarily something that we would know. It's just one of those things. So less than 5% of embryos won't survive the thaw.
How to explain early miscarriage during IVF? Well, miscarriage is a common complication of human pregnancy, whether it's natural or created by IVF. Humans create an awful lot of abnormal embryos. That's why we don't get pregnant often, as often as some other mammals. And when you're 30, up to 30% of up to 50% of all embryos that are created either naturally or in the laboratory have some degree of genetic abnormality. And as you get older, and when you reach 40, that reaches it can be up to 75% of all embryos are abnormal. And this is one of the reasons why we suffer miscarriages, because although the embryo may implant, the uterus processes it, and then if the embryo is abnormal and non-viable, the chances are that pregnancy will end in an early miscarriage. We often have a misconception that miscarriage, you lose a baby and there's this well-formed, healthy, happy baby hanging on by its fingertips saying, please, mummy, don't let me fall out. Well, nothing can be further from the truth. And that the vast majority of early miscarriages are due to embryo abnormalities. And of course, IVF cannot, correct for that. The only way we can conclusively diagnose an genetically abnormal embryo is to biopsy it, as Amy has said. But and then of course the miscarriage rate is much lower. But just to say one more thing about miscarriage. Miscarriage is often underestimated in humans. It is a very significant event, and it can cause a lot of unhappiness, stress, and medical and psychological problems. And just because you've had a miscarriage, it's not it's sometimes not possible just to get on with life. You have to get over it, to grieve, and to spend some time looking after yourself, because getting over miscarriage is not quick. So it's just and if you need support, if you do suffer a miscarriage, then you must get it, because again, I cannot overemphasize the importance of getting the right care if you have a pregnancy that's not resulted in a healthy live birth. Let me have a look. High AMH result and possible undiagnosed PCOS. Yeah, that's possible. AMH stands for anti-Mullerian hormone. It's the hormone that's released by your eggs, and it helps doctors and nurses and embryologists, when you do that blood test, to give us an indication of how many eggs you've got. It doesn't tell you about the quality of the eggs, it tells you about the quantity. There are other things that tell you about the quality. Most importantly, your age, your background history, whether you're taking medications, whether you smoke, whether you're overweight. But the AMH gives you an idea of the quantity. When you've got a high AMH, that means you've probably got a high number of eggs, which may be good, but it may not necessarily be good as those eggs. It doesn't tell you about the quality of your eggs. And often with polycystic ovarian syndrome, the patient has a high number of eggs of varying quality, but the AMH tends to be high. As I said before, it doesn't tell you about the quality, it tells you about the quantity. Do we know yet if the changes to egg freezing duration will affect ones frozen already, or will it apply to new ones after the change is implemented?
We don't know yet.
No.
Don't know yet. Hopefully it will be good news, but don't know yet.
Yeah, this is relating to the new law that's just been passed that extends the freezing time from 10 years to 55 years, which has been a real breakthrough for couples. So it takes away that fear factor that there's a time limit on the embryos or eggs or sperm that you've stored. So we've welcomed that as a general improvement to the welfare of our patients. But as Amy said, we don't know whether that's going to be retrospective. So it's going to apply to eggs and embryos that have already been frozen.
Yeah. Okay. Should we stop that Q&A session? That was 15 minutes. So that was
all right.
Yeah. So I'm going to put on another video, which is from hearing from two people in the group, which is Shah, the new patient inquiry team leader, about getting started with care and supporting you through the treatment. And then also from our CEO, Dave Burford, about life at care and the dedication to supporting you. So let me try and share that. There we go.
I'm Shah, and I manage Care's new patient inquiry team. We're here to make it easy for you to take your very first step in your fertility journey. We completely understand how nervous and excited you might be when you contact us. This is the start of a life-changing process and hopefully the beginning of an amazing future as a family. So it's really important that we give you all the information you need. That way, we can help you to feel much more comfortable and confident with your treatment. Whatever you need to talk about, I want to reassure you that no question is silly or trivial. We appreciate that there might be a lot to take in at first, but don't worry, we'll send you a clear information pack about the treatments you're interested in, and we're always here for any follow-up queries. My team also manage inquiries about Care Pay, our range of funding packages which are exclusive to Care Fertility patients. When you're ready, we can book you a virtual consultation with a specialist fertility doctor from your local care clinic. So, if you want more information, have a question, or wish to book an appointment, call my team. We want you to know that we are here for you at every stage of your fertility journey. We say that our patients become part of our care family, and it's true. We care deeply about you and your future, and our teams are here to make sure you have all the support you need.
The reason why we chose Care was just, one, the care that they give you, the aftercare that they have available to you, and the fact that they offer different forms of treatment, and they listen to you. One thing that I've identified and what I've noticed when speaking to other people that I've met within the infertility community is there's a lot of clinics out there that don't necessarily listen to you as the patient. It was kind of a one size fits all, but with Care that didn't seem to be the case at all. They took everything into consideration, and they listened to your concerns, they listened to you as a person, and they put a package and a process in place that will help you, and fingers crossed, will give you that positive result at the end of it. So without a shadow of a doubt, if I had to go through it again, I would definitely go back to Care.
Oh, the support at Care was brilliant, yeah. I mean, the nurses were brilliant for us. You feel so
looked after,
cared by the whole team. We felt that they did care, and it wasn't just for them getting something out of it. It was actually that
ongoing support.
Yeah, and they wanted it to work for us.
Care Fertility started over 20 years ago with one clinic and the goal of helping patients achieve their dream of family through truly personal care and the most scientifically advanced fertility treatments. We've grown from that one clinic. We now have clinics across the UK, and many people have become part of our care family with over 50,000 care babies in the world. But one thing has and always will remain the same. We care for each and every patient. We care about your dreams of having a baby, and we put our heart and soul into every aspect of what Care can offer you. To provide you with the best care possible and to give you your best chance of success in treatment, we look to our own care family. From our consultants, embryologists and nurses to our admin teams and specialist fertility counsellors, we've also put a lot of thought into how we improve each and every step of your journey, which will no doubt begin with lots of questions. We know that thinking about starting IVF can be daunting for some, and that's why our care, patient services and support teams will always be there for you whenever you have a question, need advice, or simply want someone to talk to, so that you feel completely confident and in control of your fertility options. So yes, we have grown and developed over the years, but care and empathy are always at the heart of who we are. We are passionate about changing lives and creating futures, and I hope that this shines through in everything we do and everyone you meet at all of our clinics. We don't just care, we are Care.
So I think we'll welcome Charles back and try and wrap up with a few final questions. If he can come back to us. I did remove him because he was giving us feedback on that video. So just see if he's gonna pop back on. Here he is. Thank you.
I'm back.
Good. Seamless, that was.
It was seamless, yeah.
So just a few last questions, I think, before we wrap up, if that's all right. So we've got a couple left over. So my wife is currently taking trazodone. Would she need to be clear of the drug before we could start IUI IVF? If so, for how long?
Oh gosh, you've got me there. I don't know what trazodone is. Why don't you do the next one, and I shall just refresh my memory as to what trazodone is.
Yeah, so we've had a question, is the risk of abnormal embryo increased by poor sperm morphology? So there's some evidence to say that sometimes poor sperm morphology can reduce the quality of the embryos, the way that they look. So we've got something at Care called the SOS test, which is the sperm oxidative stress test. And usually lots of the problems with sperm stem from this oxidative stress. And if we can detect that in a sample, then we can provide treatment for a couple of months to the partner, to the man, and hopefully reduce the oxidative stress and increase the chance of better embryo quality. We've also got something called Zymot, which is a method of sperm selection for ICSI, and that also helps to reduce the chance of poor embryo quality in IVF by selecting sperm that have got better formed DNA, better formed chromosomes in them. So we've got treatment options available, but the short answer, I suppose, is yes, there is some evidence to say abnormal embryos can be increased by poor sperm morphology. Yeah.
Okay, going back to the trazodone one, Amy, my advice would be, yes, I would advise you, to, if at all possible, to be off the trazodone, because we don't know what the risks are in pregnancy, although they're probably minimal. However, what you've got to bear in mind is that you're taking trazodone for a reason, and if you are, it's very important that there's a risk-benefit analysis. The disease process that you're suffering at the moment can also affect a pregnancy. So I wouldn't come off it if it's going to affect your mental and physical well-being. You have a careful conversation with your general practitioner in the first place, and then, if necessary, come and see us at the fertility clinic, and then we can develop a management strategy which is best for you, to give you the best chance of a healthy baby and a healthy mother. So that would be my advice.
We've had a couple of questions about DHEA. Do you want to answer that? What is it and how does it help?
Yeah, DHEA, dihydroepiandrosterone diacetate, is a hormone that's a building block for estrogen. So the theory is you take DHEA, it gives you a higher estrogen, and that might feed the egg and make it better quality. Well, the theory's there, it's never been proven, and it's what we would categorize as an add-on. But it's an add-on therapy that certainly won't necessarily do you any harm. You might have side effects. It's not that expensive, but whether it does you any good or not, it's debatable. So I wouldn't. It's in that category of royal jelly and those sort of things that are of no unequivocal proven benefit, but they're not harmful. So it's really up to you, provided you are informed, you know the benefits, you know the risks, you know how it's going to affect your health, then really it's one of those that's up to you.
Yeah, good. Okay, so last question, I think, about short protocols. And this patient in particular responded better on a short protocol, and do Care use short protocols?
Yes, we do. We are fans of short protocol. That's our standard procedure. There are many advantages of short protocols, mainly because they are short, and they're not. The outcomes are every bit as good as longer, older. We used to use longer protocols many years ago when we didn't have the technology or the drugs for the short protocols. But yes, we do. Not that short have any benefit in terms of outcomes in live birth rates, but they tend to be shorter, less side effects, and more easily to manage than the traditional longer protocols. But of course, we are we are here for the individual. We treat everybody as an individual, and we try and personalize the service depending on your needs, your medical needs, your physical needs, and your social needs. So we wouldn't do anything without you having a clear knowledge of what's happening to you, what are the benefits and what are the risks. And if you don't know, or you didn't understand the first time that we chatted it through, ask again, because you need to know what's happening to you before you start.
Yeah, fabulous. Well, thank you very much.
Pleasure, Amy. Nice to see you again.
Yeah,
hope to
nice
see you
to
again
see
soon
you.
in Liverpool.
Yes, definitely. I'll be there very soon, I'm sure.
Very good. You have a nice evening. Bye, everybody.
All right, thanks, Charles. Bye. Okay, so thanks everyone for attending. I hope it's been informative. You can get more information or book an appointment with the team. I've given you all the information, you know where to find us. If you've got any unanswered questions, we'll get back to you via email. And I'm just going to leave you with a few final words from Care and a short video about how you get in touch and learn more to book a consult.
Because of our expertise in the field of assisted reproduction, we offer very simple treatments to very complex treatments, a huge range of treatments that are very much tailored to the patient. The very simplest might be a timed intercourse that we can just support.
1 in 6 people need help to grow their family. You're not alone. And our Care family will do everything we can to help your dream of family come true. There are over 50,000 Care babies in the world today, and behind this success is our promise to make more heartfelt dreams of family become reality by ensuring our care goes into everything we do for all our patients every single day. You will receive truly individualised treatment, a patient-centric approach with empathy at its heart. We understand how nervous and excited you might be about getting started, but you can be assured of kindness, empathy, and all the information you need from our new patient inquiry team. We are all here to make it easy for you to take your very first step in your fertility journey. Call our team on 0800 564 2270 to learn more and book an appointment. We don't just care, we are Care.